Hi everybody, I'm Jason. I'm with the Thomas Jefferson Health District, and we've heard from a lot of you that you have questions about what happens if I test positive. Specifically, what's a contact investigation? So today we're here with Kendra, one of our investigators, who is going to answer some of our questions for you. So, hi Kendra, thanks for being here.
Thank you for having me.
Yeah, absolutely. Well, thank you for all that you're doing. So to get us started off, what is a contact investigation?
So simply put, a contact investigation is an investigation that we do when we find out someone has tested positive for COVID-19 or has been exposed to COVID-19. So it's a very simple conversation that we have with our community members.
That's great, and obviously very important. So who is it exactly, though, that's doing these investigations? Can any agency or doctor do them, or is it somebody specific?
Great question. So our staff here at the health department conducts those investigations. So at this point, it's all hands on deck. Everyone has been trained properly and know how to ask those questions to our community members and anyone who tests positive.
Gotcha. So I'm imagining then that in these conversations that you're having, I would have to give a lot of my health information and personal information. So if I give that to you, does that mean that anybody in the public can have it and that it's public information then?
Another good question. Absolutely not. So as a state health agency, we obviously have to follow HIPAA, which means that we cannot provide your health information to anyone.
Gotcha.
So this information we utilize to basically narrow down exposure and your contacts. So you don't have to worry about your information being out there floating about.
Gotcha. So if my information is safe though, what about when I give the names or the places that I've been and I say that I may have passed on the infection to them? If I have to give you their information, are you going to tell them that it was me who may have exposed them?
So again, we work with our contacts as closely as possible to make sure that we uphold their confidentiality and privacy. So it doesn't mean that we'll relay that information out there to any and everyone.
Cool. Well, thanks. That makes me feel a little bit better.
Glad to help you with that.
So if I test positive, for example, how soon can I expect a phone call from the health department to do one of these contact investigations?
Yeah, so as soon as we get the labs, we initiate that contact to the person who tested positive.
Okay, so I don't have to wait too long then?
Not too long.
Awesome. That's great. And how scary are these phone calls? Should I be afraid if I find out the health department is calling me? Do I need to worry about what's going to happen?
Absolutely not. So we're definitely here to help. So
Okay.
It's a very easy, relaxed conversation. So nothing to fear at all.
Okay, great. What other things do you think might be important for people to know during this time?
I know it kind of feels like we're beating a dead horse, but obviously we want to make sure that you're washing your hands, practice social distancing like we are now, right? It's kind of hard to do, of course, because you want to be there with your loved ones, your friends. We are like very social creatures, but practice social distancing, so 6 feet apart, wash your hands, just continue to practice normal hygiene, wipe off surfaces. Yeah, everything that you would do during cold and flu season, just elevate it up a little bit.
That's great. Well, I know that you've got some investigations to get back to.
Absolutely.
So we don't want to take too much of your time, but thank you so much for being here today and giving us a little insight as to what might happen if we test positive or we're part of a contact investigation.
Thank you for having me.
Absolutely. And if you have any more questions, you can feel free to leave them in the comments below, or you can give us a call on our hotline at 434-972-6261. That's 434-972-6261. We also have some of this information and more for you on our website at tjhd.org. Thanks, everybody.